We got a call about that has 2 positive cases in the law enforcement from this particular county jail. And I'm bringing this up to illustrate that this is going to be an example of what I think will be our new norm in many regards. And that is, again, we have 13 counties where things are plateaued or getting slightly the wrong direction. Those are mostly rural counties, where very few numbers make a big deflection in the statistics, if you will. But the counties that we've talked a lot about, the ones with meatpacking plants and the largest population counties, the 4 or 5, including the ones with Lansing, are going the right direction. So I'm bringing up this county jail for an interesting reason, and that is part of the new norm will be responding very quickly when there's, in this case, an outbreak, which is again defined as 2 cases in one setting. So we found out about these 2 cases. We responded on site at the end of the day yesterday, and today have tested, and before the day is out, we will know the approximately 220 law enforcement and offender populations. So in less than 24 hours, we'll have responded with I kind of refer to it as a strike team that's ready to go with testing to respond quickly. And I think it's a great example of what will become our new norm. And that could be whether it's in a nursing home or any kind of a setting, really. New topic, pediatric multi-system inflammatory syndrome. I've talked about this before. It's a multi-system disease in children and young adults caused by COVID-19. We currently have 2 young Kansans hospitalized at Children's Mercy Hospital with this syndrome. While it has been said that COVID-19 rarely impacts children, there is much that we do not know yet about this virus, and this is one of those examples. And as the name suggests, pediatric multi-system, meaning it involves neurological, pulmonary, heart, GI, liver, etc. And as we continue to learn more about this, it looks like we're gaining more understanding about the physiology of this virus. Brief science moment. The coronavirus thought to be a respiratory illness primarily, and that's how it is acquired. And yet it's clear, as the medical literature is coming out, that it is acting different than any other respiratory virus in causing what we call a vasculitis, meaning an inflammation or even infection of the blood vessels, which would explain why in adults require occasionally kidney dialysis, why it affects heart. We've talked in the past about strokes, even in young people, and the common thread seems to be that it affects and infects the blood vessels. We'll continue to monitor and give you more information as time goes on. I received word today additionally that we have 2 other infants, one age 2 months and one age 4 months, that have active COVID-19 infection. So again, we cannot let our guard down, and we cannot make any assumptions that children are somehow get off scot-free from this. They don't. We're working with long-term care facilities. The long-term care facilities have been uneasy, nervous about having patients that have left the environment to be hospitalized, for example, and then to return, because we've talked before, patients can remain positive in terms of their nasal pharyngeal swab for the virus for long periods of time. And the response has been good. Because we can't, a couple things. One is when a patient is ready to leave the hospital, they should go back to their home. And if their home happens to be a nursing facility, that's the right place for them to be. It's also in keeping with what is in the wheelhouse of the expertise of nursing facilities. Nursing facilities take care of, there's an infection called Clostridium difficile, which is a GI infection that older folks can carry chronically. They know how to take care of that. MRSA, a multiply drug-resistant Staphylococcus aureus, is another chronic infection we oftentimes see in nursing home populations. And I think that, our new norm will be people have had COVID-19, they've recovered, they've met the recovery standards in terms of how many days since onset of fever and that kind of thing, and will rely less over time on the nasopharyngeal swabs to give them the kind of clean bill of health as it were. And you know, it's interesting to look back historically. I can remember in the late 70s and early 80s especially, how we went through the same ideology with HIV, because it was hard for patients to come to hospitals, hard to get surgeries, it was hard to discharge people with HIV, or what became known eventually as HIV. And we will just become more competent and more familiar with it over time. I was listening today to an interview this morning with the former Joint Chiefs of Staff Chairman General Martin, he's retired now, General Martin Dempsey, that a crisis follows a term in which we oftentimes call in the military the order of effects. The crisis has characteristics and it kind of runs in cycles. The first step is triage. And in many regards, and I think it's in keeping with the moving into the next phase of the opening up Kansas plan, we are through what I think of as kind of the triage. We understand more, we've got more capabilities. I think you feel a general sense of a little bit more relaxation about how we're doing. And yet it's important not to become complacent, because really we are moving into another phase of complexity. And there will be second and third order effects. For example, this pediatric multi-system inflammatory syndrome, this could end up being a big deal. We haven't had that many cases identified yet. Even things like protests and unrest, I think when people are scared and worried and feel like they're imperiled, and then there's something that tips that, I think a second and third order effect is some of the dis-ease that we're seeing out there now, contributed to by the COVID-19. And it's a reminder that what we say today might require some modification next week, next month, because we must remain creative and we must remain nimble in terms of responding to this virus. And by nimble, referring, for example, to that case with the county jail. That required creativity and it required preparation, and we had to be nimble to respond. That's what our new normal will be. That's the end of my comments, Governor.
Questions? Yes. Actually, a question for Dr. Norman, and maybe a follow-up question for the Governor. One of the big points of debate on the coronavirus legislation was the protections, how they were written for nursing homes. One of the persistent themes of that debate was that KDHE is in effect requiring nursing homes to take people back if they've been hospitalized for coronavirus, and to admit people to live there without testing, regardless of what their status might be. That's how it's been described. And therefore, the argument, Governor, is that they need better protections than they've got in that bill. First, what has the guidance been from the state? And then what do you say to that, Governor?
I'll take a first whack at it. The guidance, well, first off, one must remember where this and it is guidance, not a requirement, came from. And this is an advocacy position for people who are in skilled nursing facilities. And the reason is, around the country, and even in this state, we've seen people that are ill, of undetermined cause, sent to the emergency department in wholesale manner, and we cannot have our most vulnerable people sent out of skilled nursing facilities and not welcome back, because then they are truly cut loose to be on their own. Anytime that somebody has anything that suggests an infection going on, we will test, and we'll test like we did on that very first patient in Wyandotte County. We tested every staff member and every resident that were in that associated with that facility. So we will continue to do the outbreak investigations. But we can't have patients just stack up in the hospitals either, because that isn't a good use of space there. But they need, when they're better, they need to go back to their home, really. Do you have the response?
Yeah, I think, John, you're referring specifically to the immunity clauses within the bill. I think the negotiated compromise was, no immunity at all, nothing different than what they already have. to the desire to give them sort of blanket immunity. And we negotiated to a much more narrow interpretation so that they have affirmative defense, but folks can sue. I mean, there is no protection from lawsuits in the bill. So that still exists. So if there's gross negligence, things were done completely wrong, those people have recourse now under this bill like they did before.
Some people were saying hospital, what is the difference between a hospital versus a nursing home? They said hospitals get more protection now with this bill versus nursing homes get less. Is that true? And do you see them as being different?
Well, I think there's legally sort of a difference within the bill, but I think when all is said and done, it's going to be pretty much the same protections, because no matter whether they got sort of the blanket immunity only for the period of the pandemic, let's understand that all of this expires January 26th. And then we go back, and there may be renegotiation to do something else, depending upon what the situation is in January. But all that we're talking about right now just goes through January 26th. And neither one, whether it's what the hospitals have and the medical providers have or the nursing homes have, allows for just throwing away all the rules and regulations and the need to abide by and not be negligent and to use proper protocols. That's not gone. That's still in there.
Governor, do you have any knowledge about how nursing homes in Kansas have responded to this pandemic that causes you to oppose immunity for these facilities?
I'm sorry, Jonathan.
Is there anything you know about how nursing homes in Kansas have responded during the pandemic that causes you to oppose granting immunity to these facilities?
No, there's nothing specific that's happened during the pandemic. But there's no doubt, it's out there that some nursing homes in the state of Kansas have been pretty bad actors over periods of time, and we have had issues and concerns in there. I will also say that our ability to inspect and oversee nursing homes was decimated during the previous administration, so that we really couldn't get in there and catch the problems before they got too bad. And so I think that knowing that history made me much more reluctant to offer sort of blanket immunity. I thought we really needed to keep some guardrails in there.
Governor, a lot of Democrats, though, had concerns about having any immunity provisions, businesses, medical personnel, anything for nursing homes. The trial lawyers were pretty angry afterwards, saying that a lot of people were losers, workers, nursing home residents, et cetera. They were the losers. There were no real winners. Have you damaged your standing with your base, with Democrats, and by accepting this compromise?
Actually, that never crossed my mind, John. When we were negotiating this compromise with the Republican leadership, I was working to get what I thought was the strongest bill possible for the people of the state of Kansas. And, quite honestly, there probably wasn't anybody happy on either side because nobody got everything that they wanted. And I think whether you want to call them my base or just folks out there who felt very strongly about this, I think most of them understand that the need to compromise to get anything done. We had to get past a stalemate. We had to have emergency declaration in place. There was way too much at stake to hold out for everything you wanted.
And can I ask? I'm sorry. May I ask a question? Mr. Secretary, you mentioned 13 counties. I think you actually did that the other day, and I forgot to ask you what those counties are, so I don't have to analyze your online map. You could rattle those off.
I don't have those. I have the other 8 that I mentioned memorized, but I don't have those.
Good 8. Do you have those?
The 8 that I said are the 4 with meatpacking plants and the 4 largest ones. I do have those.
Can somebody on your staff help me
I'm sure that would be possible.
Well, I did have a follow-up, because I was looking at the numbers county by county and have been for a while. And the last 2 days, 70% of the new cases are coming from the 4 most populous counties, which, if I'm doing the math roughly in my head, roughly about half the population. Very sharp contrast with Douglas County, the 5th largest, where the growth in raw numbers has been very small. And so I'm kind of wondering, what are you seeing that makes you comfortable with those most populous counties? Because, for example, in here, since the 20th of May, I think the number of cases here has grown about 33%, from about 200 to more than 300.
Yeah, the question is one of the timeline. If you look over a day, you can see dramatic increases. If you look over a week, you can see increases. If you look over a couple, let's say 2 incubation periods of 28 days, that's how you fit the curve, because what you're really talking about is what's the general trend line. One of the most important indicators of disease spread is a percentage of positive tests, and that's going down quite dramatically over time.
Doctor?
Yes.
I think you said, you can correct me if I'm wrong, that you look at other countries 2 months ago, like China and such, so you can see what they've gone through in that 2 months. For us, in 2 months, that's when K through 12 in August will start going back to enrollment stuff. So that being said, what's going to look like in August by basing it off what you know in the other countries?
Yeah, so it's really about the forecasting. And forecasting is tricky, and a lot of it is difficult because of the fact that, because as the counties and communities open up, the question is whether that same trend line will trend down. It is still believed by us and others that we consult with on the various models, and there's a dozen models out there. We use somewhat of a blended approach, is that it'll still continue to decline even at the start of the school year. But what we're worried about is a second wave later on in the fall and winter.
Has your perception of the second wave changed at all? I was talking to a legislator a day or 2 ago. He said he was looking at some type of model that says maybe the second wave might not ever come or might not be as bad as previously thought. Has anything changed on your end?
No, nothing has changed.
Governor, I had a question about your Spark task force. First, this idea of doing the emergency eviction, mortgage renter thing, would that be paid for with the CARES Act money?
That's what we're looking into, and that's why I said, we have to look to see if this is a feasible option, but certainly something we want to explore. We really do understand that, it's sort of a no-win situation for either one. I mean, if we leave, now we may be putting the onus on the renters or the homeowners themselves, leaving it in place where you can't evict, you can't foreclose, then the businesses are on the hook. So we have got to figure out a way to resolve that problem. And if spending some of the CARES money will help us do that, and we legally can, we will.
The first $400 million, though, goes out, and you're hoping to get that out in June. Are you going to do that before you sign the bill and before that finance council process kicks in, or are you going to wait for that process to kick in?
I'm not interested in poking the pig, John. I think, given how close we are, the bill has been passed. I think it'll be on my desk very soon. And I think that we'll be able to call a state finance council quickly and have them put the final seal of approval on that. And I would like to deal with this the way that, I have by virtue of agreeing to sign this bill, said I'd do it.
Do you anticipate taking action on the budget before the end of the fiscal year for the next fiscal year? As obviously we had a good revenue month in May, but the projections still show that we're underwater next year.
Yeah, we are not above water. There's no way. And so what we will do is be getting with our budget office. We'd already done sort of a preliminary review of that, and we've been waiting, hoping that Congress would get it together and do stimulus 4 and provide, revenues to the state and local units of government so we could use it to backfill the holes that we know are there. At some point, whether we hear from Congress or not, we're going to have to make some decisions, and we're working on that to decide what those decisions might look like.
Can you solve this without real cuts to budgets? In other words, can you do this through transfers, rather than the highway fund, et cetera?
Oh, yeah, I suppose that I could do those kinds of things, just take the highway fund, take capers, but we have no intention of doing it that way. That's what got us in a lot of hot water before, and I don't want to go back to that. I'm also very committed to, as much as possible, protecting what I consider our economic development infrastructure processes, and that would include not only transportation and broadband and education, but it would also information technology, to make sure that when we get through this, because we will get through this, that we don't leave a crumbled foundation, that we've got something to build on. So we're looking at it, and we're trying to figure out every way we can possibly balance the budget without destroying our future.
Yeah, but Governor, if you're not going to do capers and you're not going to do the highway fund and you're not going to touch funding for schools, and you're not going to touch IT and stuff, that leaves the rest of the budget is prison, social services, and higher ed. And 600 million plus out of that is...
Well, I haven't committed to not touching anything at this point, but what I'm just telling you is, as I'm looking at what we're going to need to do, those are the things that I'm thinking about. I want to protect as much as possible what gives us a foundation to grow on when we get out of here.
One more question?
Dr. Norman, I know you've been asked this in the past, but it's been a while. I'm just wondering, can you reflect, and I only asked because you had mentioned this, given some information about a few of the clusters, but what's your philosophy in terms of publicly identifying cluster sites versus not identifying cluster sites? How do you kind of make that decision?
Cluster size or sites?
Sites. Like
Sites.
specific locations.
Yeah, we typically do not release the cluster sites, but leave that to the county to decide. Sometimes we have to, like the Turnpike restaurant out here. There's no way that we could do contact tracing, because you just don't know who's coming and going. So that is a time when we will put it out there into a news release if it aids. But we do rely on the counties to the level of discernment as to whether it helps them in their investigation. A lot of states, they are automatically released into the general public information. And you could argue that that's a good idea as well, because you may not be able to to contact trace everybody. So an argument can be made both ways. We prefer to let that go to the county.
The provisions on contact tracing in the bill, do they do anything? Do they do any harm to what you're trying to do?
Well, the question was about contact tracing. I was glad that there was a change made that didn't cause a cessation to the contact tracing while there were rules and regulations promulgated, because we're doing contact tracing 7 days a week. So that was good that change was made. A philosophical question about the use of electronic tracking, that was something that apparently is not considered palatable, and the reason it came. So I think that will hamper us just a little bit. We're not doing that now. The technology is not really mature, and I don't see that as a big loss, because we're human detectives right now.
Thank you.